If I'm not a diabetic or a pre-diabetic, should I consider getting a CGM or a continuous glucose monitor? Look, I think it's a good idea for people to understand how their body is reacting to the things that they eat, because you could be eating something that is generally healthy for most people, but it's not healthy for you. And therefore, that thing, maybe you have a food sensitivity for it, against it, is causing a cortisol response and jacking up your blood sugar, even though it's not inherently something that is a high glycemic index food. So, should somebody use a continuous glucose monitor if they're not diabetic or pre-diabetic? I think it's a good idea to use one for a little while and really get an understanding of how your body's responding, again, to the foods that you eat, because you may not understand or may not know what's going on. Do I think you should get obsessive about this? I do not. If you're not a pre-diabetic or diabetic and you have a healthy diet, then no, I do not think that this is something that you should get obsessed about. Um, if you have a poor diet, well, don't bother getting a continuous glucose monitor. All right, it's going to just tell you you need to eat better, and you should already know that. All right, you should already know that look. If you have a crappy diet, if you have the standard American diet, no need to get a continuous glucose monitor. Clean up your diet first, and then use one to determine if what you're now doing, it still needs refinement. Meaning, let's say you have, and I mentioned this a minute ago, if you have a food sensitivity to, say, green beans, right? And you love eating green beans, but green beans are a low glycemic index food. It's a vegetable. I have to edit that out. It's a vegetable. You would normally think this is good for you, but if you have a food sensitivity to it, it could be causing inflammation in your body and thereby jacking up your cortisol and your insulin and impacting your blood sugar. So there are ways of using these to get good information to improve your health. The first thing to do would be to clean up your diet, so you're not getting information that you should already know just based on the fact that you're eating crappy. Anyway, I'm Dr. Dave Morris at Magnolia Medical Center here in Murfreesboro, Tennessee. We're a root cause functional medicine clinic here in Middle Tennessee. Our goal is to help people get well without the use of drugs and surgery. We try to bring you good information so you can make better decisions about your health, live longer, and have more life in your life. Anyway, I'm Dr. Dave Morris. Leave me some likes. Hit the share button because somebody else might need this information, right? And hit the follow button for great health information coming at you.